I'm Evan Stein. I'm the program director in radiology here, and I truly, amazingly love teaching. And as program director, the thing that I love the most is I get to oversee so much of it. The residents train 100% here at Maimonides Hospital. They work either in the hospital, at the breast center, or at one of our local outpatient centers, where they get a lot of exposure to outpatient imaging, which is sort of the bread and butter kind of cases.
One of the strengths of our program, and I think one of the strengths of all the programs here, is the fact that we are the largest hospital in Brooklyn, which in and of itself is one of the largest cities in the country. And we really care for a very diverse population that comes from all over the world.
Location-wise, we're at the crux of a few different ethnic neighborhoods. Borough Park is heavily Jewish, particularly Orthodox Jewish. There's a lot of Chinese, but of various different regions. There's a large Arab population, and then not to mention all the Brooklyn diversity in general.
We are a level 1 trauma center. We have a very highly active cancer center. We have a pediatric hospital, and we also have busy services in cardiovascular and surgeries.
I think the most special thing about this place is the variety of cases. We are like a stroke center, a trauma center. Here, every single case in general has a lot of findings and a lot to learn from.
But we don't have fellows. So when we have these cases and we see these things on call, the first people to see it is us, the residents.
We often see many types of disorders you may not see elsewhere, and you may see them in later stages that you may not see elsewhere.
I saw a prostate cancer metastasized to a male breast. And my attending looks at me and she just goes, "Brooklyn, man."
I really think that working with residents is the best part of the job. And when you're working with people who are seeing this for the first time, their excitement is contagious. Their experience also reminds someone in my position not to take what I know for granted.
We rely on our residents to be capable and involved in those sophisticated procedures. So it may not sound like it, but starting from the earliest times, I have first years and second year residents who are doing fluoroscopy-guided lumbar punctures, fluoroscopy-guided myelography, and now CT-guided myelography.
I've already had experience doing angiograms and getting arterial access and treating PE thrombectomies. And those are cases that at most places fellows would do.
You are either the second set of hands on every case, or in some cases, you are the first set of hands on every case.
We have state-of-the-art equipment in terms of both imaging and our PAC system and our ability to function in a teleradiology environment.
So when I joined the residency in Maimonides, it was around 2005. I actually did my internship here in internal medicine, and then I did my radiology residency. And back then, the neurosurgical division wasn't as strong as it is today. The neurointerventional wasn't as strong as it is today. All the tumors that I used to see the case, and then once we would see the tumor, it would get referred to an outside institution. And today, we're getting referrals from downstate, from all over the Brooklyn area. And then the cancer center has grown dramatically. And so now the cancer center is a very robust institution. Obviously, we do chemotherapy and we do a lot of radiation therapy.
I have actually been here for a very long time. I started here as a resident in 2005. And I finished my residency here, I finished my fellowship here, I stayed on as an attending, and now I am the Associate Director of Breast Imaging. It's been a while. The Breast Imaging Center opened in its current location in 2010. We were really excited about opening up a facility that was very much devoted to women. We wanted it to be comfortable for women to come and get their imaging done, particularly because it can be very stressful for a lot of patients. It's a very anxiety-provoking experience for some people. We made sure that it's comfortable and warm and reassuring for our patients.
The center has grown exponentially over the years because people realize they're getting very good care here. So we were the first breast imaging center of excellence for all of Brooklyn, so we raised the bar for Brooklyn. We practice very high-end academic medicine. We now are about to purchase our 5th mammogram machine. We have 5 ultrasound machines, a 3T MRI, and a stereotactic biopsy table.
Not everyone is cut out to work with residents. Many radiologists don't want to work with residents. So it's really important that you find a program where you're working with attending physicians, with faculty who enjoy being with you and enjoy spending time with you.
I think we have a very collegial program. There's a lot of camaraderie, and we all kind of respect each other and understand that we're part of the same team.
I think the whole point is that we work in a place like Maimonides because we expect the residents to be there, we expect them to be excited, we expect them to be interested, and we expect to teach them, and we expect them to learn. That's part of the package. It's part of our job, it's part of what we do.
That's one of the best things that I feel like we can offer, which is this intense level of training, incredible levels of pathology, and as much as it sounds silly, a job as you walk out the door.